Good afternoon, everybody. And again, thank you for joining us for another one of our briefings. Our briefings happen, of course, every Monday, Wednesday, and Friday, normally at 3 o'clock. We had to move ours today to 3:30, but I want to thank you again for joining us. We have a full briefing, a lot of important announcements, and we also have a guest with us that's been critical to our work here in Long Beach, and that is our LA County Supervisor that represents not just Long Beach, but many cities that surround our city, that's Supervisor Janice Hahn. And so I do want to thank her. And I also, of course, want to thank our director of our health department, who will be giving an update as well about our updated health order that we're going to discuss today. And as always, we have Paola, who is behind us, who is doing our translation to ASL. And we have Teresa, who is going to be with the health department, who at the end of the brief, she will do a summary for us in Spanish as well, and en español también. So thank you again. So just to start off, I want to begin by giving some overview of where the numbers are at. And then I want to talk extensively about our new health order and some of the new rules that we've put in place. And then I'll end with some remarks about our testing site. That's a partnership with the County of Los Angeles. And then I'm going to turn this over to Supervisor Hahn for remarks. I want to begin just by letting people know that we now have 316 cases in Long Beach that have tested positive. We know that this number increases every day. It continues to increase, and we should expect that number to go higher in the days ahead. We are also saddened to report that we are now up to 9 deaths related to COVID-19. These 9 individuals, like I've mentioned before, most are seniors. The latest deaths that we've had range from in their 50s to their 80s of the total of the 9. And we know that also about half of them have been individuals that have been within our skilled nursing and senior facilities in the city. And so that's really a tragedy, and it's something that we're addressing every day with our health partners. I want to also remind people that just because we have 316 positive cases does not mean that those are the only folks that have COVID-19. We expect and know that there are many others likely that have COVID-19 across the city, across the county, across the country that just haven't tested positive yet, many of whom will have no symptoms, which is why it's important that everyone stays home and that everyone follows the orders that have been implemented here in Long Beach, in the county, and across the state. Let me start just by saying that the last time we put out our major order, when it shut down and transitioned some of our businesses that were not considered essential, and put limits on restaurants and bars, we had set a date in April that is just not too far from now, where the order kind of ended or would sunset. I want to begin also by making it clear that our order will be extended to May 15th. So May 15th is the new stay-at-home order extension in the city of Long Beach. That is the same aligned date that the County of Los Angeles has also extended their health order to. So as a reminder, it's important for us in Long Beach to align with the County of Los Angeles. Even though we have separate health departments, we're working together as a team, we're aligning our dates, and we're ensuring that our health orders are as close to each other as possible because we want there to be a seamless public health infrastructure across the county. And so May 15th is the new date. So what does that mean? That means that the restrictions as it relates to our stay-at-home orders are in place. And we should expect that if things don't improve, that could certainly, that date could change. But as of now, that is the May 15th date. That has impacts, as we know, to all of our non-essential businesses, which need to remain closed. That includes, of course, limits as it relates to our public beaches and parks, and all the things that we're already doing today need to be extended to May the 15th. In addition to that, not only are we doing the extension, but we are implementing beginning tonight and through the weekend, and we know some of these are going to take a few days to implement, a variety of new pieces to this order, some which are more restrictive but which are meant to protect the public. We've talked that the critical weeks ahead for us in California are those that we have ahead of us. And so it's critical that over these next couple of weeks and through May, we are even doing more physical distancing and doing even more protections for members of the public. So what are we doing in addition to the May 15th deadline? The one thing that we are doing is we're asking our businesses that are able to remain open, which are the considered essential businesses. Many are going to be asked to put together social distancing plans and to limit the amount of individuals within their facilities, even beyond what we've currently asked. We're also going to be encouraging the essential businesses change the way we do face coverings and masks. You've seen some of this happen already in the city of Los Angeles, but the county is putting out official orders today as well that cover this issue. And what do we mean by that? For one, we want to make sure that our frontline workers are being protected and that those that are visiting places like our grocery stores, our markets, and our restaurants are also protected. Let's talk about our grocery workers. Our grocery workers are some of the hardest working folks out there right now. They're on the front lines every day, and they're getting us our food that we desperately need. And so as part of this order, we are ensuring that our grocery workers have face coverings and masks to protect themselves and the public. We're also ensuring that the public also wear face coverings when they enter businesses to protect themselves and our workers. We're also going to have requirements to ensure that employees can wash their hands every 30 minutes. We're going to make sure that our not just grocery workers, but other workers have the ability to be protected in their workplace. And that's something that we have committed to them who are working so hard and others across the county. The same goes for restaurants. Our restaurants are a critical food supply for the community. So we're going to be part of this order ensuring that restaurant workers, those that are doing the take to go, those that are doing the preparing the food and then giving the food to the customers picking up their order also have face coverings, and that the public also is encouraged to please wear face coverings whenever out in public visiting these locations. We want to ensure that essential businesses also provide hand sanitizers in areas and in the entrances, and that they regularly disinfect high-use surfaces. Now, these are practices that many locations are already doing and that we've been encouraging already, but they're going to be the law now because we do have some places and some businesses that are not doing everything they can to protect the public, and so we have to push even harder for the public good. So these are different changes that's going to affect drugstores, hospitality, food delivery employees. We're going to be establishing operating hours to serve the key populations such as seniors. A lot of our grocers are already doing that. We're going to ensure that it happens. We're going to provide ensure that there's adequate security and staffing to go out in the community. We'll be doing more citations beginning this weekend. The Long Beach Police Department, we have tried to do as much education as possible and warnings as possible. Most of you are complying, but unfortunately there are too many folks out there that quite frankly are being irresponsible and that are gathering in groups. And so beginning this weekend, the Long Beach Police Department will be handing out citations. And so please don't send me an email after the fact saying I didn't know about it or we've been giving out warnings for a long time. It is your job to follow the order and not gather in groups and not go to the beach and not playing on playgrounds in the parks. And these citations the police will be giving out are serious. So please take those seriously as well. We're also going to be letting folks know that there's different types of face covering opportunities and rules that are going to be put out today. But I want to note and let people know that the city has done, I think, a really good job of getting information out. We have a part on our website at the COVID-19 website as part of at the city. We have a link to a face mask marketplace that the Long Beach Post, which is one of our media companies, has set up. There's a link there. They have tons of people exchanging and purchasing masks online. It's at shop.lbpost.com. We also have a place around face coverings where you can, if you're an essential business or you're a healthcare provider and you need access to face masks, you can go, or face coverings, you can go to those websites. And I want to remind everyone, and I actually, we have one here and brought one as well, that face coverings and masks are all done different ways. You have, of course, the surgical masks, the ones we hear about that are only for doctors, that are only for nurses, that are only for our frontline healthcare and public safety workers. The rest of us, myself included, should have masks that you, these face coverings that you can make at home. This was made by a friend at home. These can be worn and will need to be worn out in public when you're going to these restaurants or these other places out in the city. And so please, please, I will be wearing my face covering. Everyone needs to be wearing face coverings. It could be a scarf, it could be a t-shirt, but those will be necessary to protect everyone. So that gives you an idea of what the order has. And Kelly Colopy from the Health Department will get into some more specifics. But I want to also note some other parts of our Safer at Home order. Remember, parks continue to be closed with the exception of being able to go through and walk and take leisurely walks and leisurely strolls. You cannot park in the parking lots in our parks. Beaches are closed. The beach pedestrian path and bikeway are still closed. And this Easter Sunday, while I know it's an important day for a lot of us, it's also traditionally our busiest day of the year as it relates to parks. And so parks will be completely closed on Easter. Completely. So you won't even be able to walk through the park or take your bike through the park. They'll all be closed and we'll be enforcing. Now, separate of Easter and indefinitely, playgrounds, sport courts, and the like will still continue to be closed. We know this is an important holiday for a lot, including myself and my family. And to those that celebrate, we'll obviously wish everyone a happy Easter weekend. But it's important that we support public safety and public health in this instance. Want to also mention that please, as our police officers are out there enforcing this order this weekend, to be respectful, to listen to what they have to say. They're trying their best to maintain order, and we owe them that during this health crisis. And I want to also just note that, and this is really a thank you, this is also the beginning of National Public Health Week. And I cannot thank our health professionals enough, our healthcare workers, our workers at the Long Beach Health Department, at LA County Health, for the amazing work. We are working hard, as you know, with our hospital system. All of our hospitals have the capacity to bring in new patients. We have expanded hospital beds by over 500 beds at the convention center, in tents across the city, at other locations. And so we are ready for this surge. And part of that has been our increase in testing. And as I turn this over for some remarks from our supervisor, I want to add how important our partnership with LA County is. Many of you have already used our drive-thru testing center that's located at Long Beach City College at the Pacific Coast campus. We know that we have two testing centers. We have one at the health department that is really focused by appointment only, first responders, critical healthcare workers. And then we have our drive-thru testing center, which is doing a significant amount of tests now that started earlier this week. And we've been ramping it up. I think we did 60 or 70 the first day, and we did 100, and that number continues and will continue to go up day after day. That would not be possible without LA County. It is the LA County Health Department that came in, provided the tests, worked with our health department to set up that drive-thru testing center, and has set these testing centers up across the county. In fact, we're using the LA County portal with the city of Los Angeles for people to get screened and to get a test. And so remember, you can go to longbeach.gov at the COVID-19 page, go to the testing area, and you can link right to the city of LA and the county's testing portal, and you can pull up where the testing locations are. And as a reminder, if you don't see Long Beach on the navigation bar, it's because all the tests are booked at the Long Beach location. So we've had that question. You can go to any of the other county locations, and as soon as more of those appointments are open, in Long Beach, it'll come back up on the navigation bar. So I want to again turn this over. That testing location would not have been possible without Janice Hahn, our supervisor. Her and I had been talking about this and getting it open. And so I want to turn it over to her to make some remarks and thank her again for her partnership here in Long Beach. Supervisor.
Well, thank you, Mayor Garcia, and hello, Long Beach. And I just wanted to start off by saying to all the residents of Long Beach, you're doing a really good job. And listening to your mayor give his regular briefings and encouraging you to do certain things to comply with all of our health orders, it sounds like you're doing a good job. And we just want to encourage everybody to keep doing what they're doing so that we can flatten the curve and stop the spread of this virus. Really want to thank you, Mayor, the City of Long Beach. As you said, you have a health department and the county has a health department, but we need to work together. And we've been doing a really good job of that. And I think our numbers show that we have been working together. We've been working hand in hand while keeping our distance to navigate this crisis and coordinate everything from our safer at home public health order to our beach closures to minimizing confusion and making our efforts that much more effective. The good news is because of what you've been doing, Long Beach, our efforts are working. And we really are flattening this curve. Today in Los Angeles County, there are close to 8,500 cases of people who have tested positive to the COVID-19 virus, and we have about 241 deaths. So our caseload is growing, but it's growing slower than it was last week. So that's a good sign for everyone. And so far, we've been able to prevent a surge of cases from overwhelming our hospitals and our medical systems. But that means we have to keep doing it. We can't become complacent. In fact, the statistic that they rolled out today was if we stopped physical distancing today, transmission would take off exponentially, and by August 1st, 95% of LA County residents would be infected. So you can see what will happen if we start being too casual about this or thinking that the worst is over. That's why both the County of Los Angeles and the City of Long Beach have extended our safer at home public health order to May 15th. And I know this is difficult. This virus is vicious. It's not only robbing people of their lives, the steps we are taking to slow its spread are robbing many people of their livelihoods. And I know that there are countless families here in Long Beach and across LA County who are suffering from lost jobs, lost incomes. And this Safer at Home extension is going to be both emotionally and economically painful. But this is the best tool that we have to fight this virus, slow its spread, and ultimately save lives. And to that end, LA County is creating new programs to help people stay home. This week, we launched a new program that provides free delivery of groceries and other necessities for adults over 60 and individuals with disabilities. There's no need to register to use this program. To schedule a delivery, you can call 1-888-863-7411 between 8 and 5, Monday through Friday. And items that you want delivered must be prepaid and ready for pickup. And again, one more time, that number is 888-863-7411. And you can call between 8 and 5 any day, Monday through Friday, to schedule a free delivery. I know that staying at home is particularly difficult for many of us during this time of year. As the mayor talked about, this week, Jewish families everywhere marked Passover without guests at Seder dinner. And this weekend, people celebrating Easter will have to do so without going to Sunday services in person or to a traditional family gathering. And I know this will be hard, but I encourage you to call your friends and family or set up video chats to make the most of this holiday. Keep your family and loved ones safe and celebrate this weekend at home. As a precaution, all Los Angeles County parks will be closed this Sunday, as well as the City of Long Beach parks. And of course, even as I urge people to stay home, there's plenty of people who must continue to work and can't stay home. And I want to thank them for their service and their sacrifice. Whether they are healthcare workers, delivery drivers, grocery store employees, restaurant workers, sanitation workers, or longshore workers at our ports, they're working under extraordinary conditions and making sacrifices so that the rest of us can stay home and stay healthy. And we have to do our part to protect these workers who are on the front lines of this crisis. And that's why LA County's new Safer at Home public health order includes a new requirement that employers give their workers face coverings. And it requires that members of the public also wear face coverings when they enter a business. Wearing a face covering will help prevent you from spreading the virus, but it is not a substitute for physical distancing or staying at home. You are still safer at home. We only recently started calling the workers we are depending on as essential workers, but I think we'll all agree that long before this crisis, they were essential. And I know that we will remember that long after this pandemic crisis is behind us. Thank you again, Long Beach. Thank you for what you're doing. Stay strong. We're going to get through this. And they say we're going to be stronger and we'll be better as a result of it. Thank you for your time today. And I'm going to hand it back to the great Mayor, Mayor Garcia.
Thank you, Supervisor Hahn. And again, thanks to LA County. The only way that we can make this happen and keep everyone safe is with partnerships. It's the partnerships that we have with the county, with the state, that really are making this possible. So thank you again, Supervisor Hahn. I want to also turn to our Director of Public Health and the Health Department, Kelly Colopy, who's going to get into a little bit more details about where we're at from a health perspective and the health order. So thank you, Kelly.
Good afternoon. The mayor and supervisor have shared a number of different elements around the public health order, and I'd really like to highlight the question that we're getting the most is around the issue of facial coverings. And so what we are saying is that we do not want people buying or wearing N95 masks and surgical masks, and to please hold those for our healthcare workers and those who are working most closely with people experiencing COVID. Instead, we are focusing on facial masks. That can be a scarf. It can be a bandana. There's a really great video on the CDC website that shows you how to make a bandana into a face mask. Any sort of covering that covers your nose and your mouth can be considered. When we think about what the face covering, so we say to wear them outside when you will be in contact with others. Contact with others means within 6 feet for more than 10 minutes. So if you are outside walking, running, exercising, and you are not in contact with people, you can be doing that without your face covering. But if you are out walking and you decide to start having conversations with people as you're wandering down the street, a face covering should be worn. We are also saying that you should be wearing a face covering every time that you enter an essential business, such as grocery stores, pharmacies, and other places. It'll be required to wear them as you go in. So what does it look like to take care of a face covering? So a face covering needs to be washed every day. So it's not something that you can take off and put on over a week. It is something that must be washed every day, because what happens is as you touch different surfaces and you touch your face covering, it then already has been, it now has the germs that you're touching. And so we really ask that you wash your hands really well before you touch your face covering, right, as you're getting ready to take it off. Or any time that you are playing with it, and that it is washed and then dried in hot temperatures, as that will make sure that anything that has come in contact with the covering can be cleaned. This does mean it's good to have a couple so you can be rotating them through moving forward. But our other concern is that people will begin to think that the face covering is a substitute for safety. and it is not. It is absolutely important to maintain the 6 feet distancing, as well as washing your hands and sanitizing your hands. So that is the first step. It is the step we want everyone to pay attention to, and that the face covering is that next step, that next bit of help that keeps the people around you safe. So I'd like to pivot for a minute and focus on our long-term care facilities. There have been a lot of questions about what is going on in the city of Long Beach around the long-term care facilities, and I want to be able to share some updates. At this time, we have 68 COVID-19 positive cases in 6 of our facilities. In Long Beach, there are hundreds of these nursing homes, assisted living facilities, and other long-term care and residential facilities that care for our most vulnerable seniors and others who are medically fragile. These residents have many medical illnesses, including Alzheimer's and other dementias, chronic and severe respiratory illnesses, including being on chronic ventilators, and other illnesses that prevent them from being able to live independently. Given their congregate nature, the fact that many of the vulnerable citizens are living in those close quarters puts long-term care facilities and their residents and staff at the highest risk of being affected by COVID-19. For those with dementia, it can be especially difficult to institute the recommendations to one's face, hands, to cover coughs, and to not touch your face. The long-term care facilities are on the very front lines of staring down this pandemic. I want to acknowledge and applaud all the administrators, managers, and staff for all of their hard work in this unprecedented situation. Your tireless efforts to rapidly identify ill residents and staff by doing daily screenings, isolating and quarantining sick and exposed individuals, wearing the right PPE when you can secure it, doing the frequent disinfecting of your facilities, and working very closely with our health department staff to rapidly institute the infection control practices to limit the spread has been so appreciated. In order to assist our long-term care facilities in Long Beach, our health department has taken a number of measures, including constant communication with facilities who have a confirmed positive staff member or resident, partnering with the California Department of Public Health to have additional subject matter experts work one-on-one with our facilities that have reported cases, delivering PPE within hours when needed to facilities who do not have it or are low on supplies, prioritizing our testing, our laboratory testing for both residents and staff of this highest risk population. And we've updated our website with the section just for long-term care facilities that includes local, state, and federal guidance. We know it has been a very difficult time for residents and staff, and we've had to restrict visitors, and we appreciate every sacrifice that is being made. The health department and the city will continue to work diligently side by side with them in the difficult times to come. Shifting again, I'd like to say a very big, happy National Public Health Week. We plan normally for Public Health Week, and we plan big conferences and all kinds of activities. And given the COVID crisis, we all put our head down, and I woke up yesterday and realized that we were supposed to be celebrating Public Health Week, and instead we're out doing the very core of who we are as public health. I want to say a big thank you to all of my team and to all of the first responders and others who have become part of our public health team in this pandemic. It's really been an incredible effort joined together. I also want to give a special thank you to all of our amazing Medical Reserve Corps volunteers, both with medical and non-medical backgrounds, who have been staffing our free rapid assessment clinic at the Long Beach City College Pacific Coast campus that just opened, and it's been raining pretty much the whole time they've been out there. It is because of these selfless individuals who are volunteering their time in our clinic that we've been able to see over 150 clients just this week and help keep our emergency rooms and urgent cares from being even more impacted. I also want to give a quick reminder that the regular hours for our rapid assessment clinic are from 10 until 6, but over Easter we are going to be cutting back for a little bit of time due to the Easter holiday, so we'll be open from 10 o'clock to 2 p.m. On Easter. We'll resume the other hours on the Monday. And finally, I want, for the latest information, please remember to go to the longbeach.gov /COVID-19 website and to call our info line at 562-570-INFO. Thank you.
Thank you. I'm going to, before I turn this over to Teresa Ayala Castillo from the Health Department to do our Spanish translation, wanted to end with 2 pieces of good news. The first is we always talk about the amount of positive cases we have, which is obviously an important metric. We also have about 141 individuals that have recovered of that group. from COVID-19 who are now at a healthier place, resting back home. Many are fully recovered. And so while that number is important to track, it's also important to track those that have gotten better. And so we want to just those that are watching and those that are there, just thank you and take care of yourselves. And we're grateful for them. And the other piece of good news is we just recently, as you probably know, set up a coronavirus relief fund that we ask folks to donate and to contribute and to text your contributions. That we're almost raised $1 million to that fund. We are going to be hitting that million. I think in the next few days. And so that relief fund, which you can contribute to by going to the longbeach.gov website, is through our partnership with the Community Foundation. Or you can also get involved in different ways and go to their website and text and do a bunch of other ways to give. And so thank you for that. And we'll certainly celebrate at the $1 million because it's going to so many organizations that are feeding the hungry, supporting seniors, supporting people experiencing homelessness. And we're going to raise a lot more thanks to all of you. And with that, I want to turn this over to do a Spanish summary for Teresa Ayala. But actually, I think we're going to do questions first from the media, and then we'll do the summary, I'm being told. So why don't we go ahead and do the questions.
Today we're going to be taking live call-in questions. Our first call is from Haley Munguia from SoCal News Group. Haley, go ahead.
This question is for Mayor Garcia. I guess the first part is, when will the amendments to today's order be effective? And will the LBPD be enforcing those amendments with citations?
Yeah, the health order goes into effect tonight at midnight. Now, there are pieces of that order, obviously, that may take a couple days to implement, and I think it's laid out in the order, but we're expecting that order to take place immediately. As far as the Long Beach Police Department enforcing the order and all the other kind of rules that we put in place, that is going to start happening this weekend. You've probably read in some of the publications, including I think yours, Haley, that Long Beach PD is going to be doing citations, and so you will see them do that over the course of the weekend. And so I just encourage folks to follow the rules.
Next up, we have Valerie from the Long Beach Post.
Yeah, we've been getting a lot of questions about planning.
Hang on, Valerie, we can't hear you very well. Can you say that again?
Sorry. Yeah, sorry. So we've been getting a lot of questions about what kind of cloth masks that you need. Do cloth masks need some type of filter in order to be effective?
Do cloth masks need a filter?
No.
Yeah, in order to be effective, and if so, what can be used as a filter?
So cloth masks, the point of a cloth mask is that they are holding your own germs to yourself. So the cloth masks that you are wearing are not, they do not protect you from others. What they are doing is protecting others from you in case you are asymptomatic. So that is the purpose. Any kind of cloth will do. A sort of a tightly woven cloth is the best. As long as they are being washed regularly, they are fine.
And then next up, we have Kelly, also from the Long Beach Post.
Okay, can you guys hear me?
Yes.
Yes, thanks, Kelly.
Sure. We've been getting just a lot of general questions. People still a little bit confused over what they can do. Can people go on a bike ride if it's by themselves? Can they, sit on the grass with their spouse or their live-in partner? Just a little bit more of a general idea of what exactly can we do this weekend?
Kelly?
So, yes. So the key piece is that you cannot be in contact with others, right? Without a cloth mask. So if you are out riding by yourself and you're not getting within 6 feet of anybody for more than 10 minutes, then you can be out riding. You can be out running, you can be out walking, giving people the space that they need. But the parks are not for sitting. They are for, you can walk through them and moving through. But the parks at this time are not a space where that people should be spending time other than as a space to be walking and engaging, maybe walking your dog or others.
Yeah, and I think because I get these same questions as well, and I think to expand on what Kelly said, then the best way to think about it is that while our parks are generally open, but not this Sunday, right? Well, parks are generally open. They're meant to walk through. So you can walk, if you're walking on a trail, you're walking through the park, you're walking around, you're biking around the park. At no point should folks be gathering, whether it's you and family, whether it's you and a spouse, there shouldn't be gatherings of people hanging out at the park. You need to be walking through a park for exercise or to get from one point to another. Beaches are completely closed. And as far as face coverings are concerned, I always say it's better to be safe. And so the best way to look at it, what really encouraging is if you are going to go out of your home, I would suggest to wear a face covering. And you're certainly going to need one if you're going to go to a restaurant to pick up food or to the pharmacy or to the grocery store. You're going to be required to wear one. But if you're going to go out in your neighborhood alone around the block, I mean, whether you wear one or not, you've got to make that judgment call, but you should wear one. And so I think that's the key piece of it is wear a face covering if you're out, and you're certainly going to be required to if you go into a business and there's no gathering whatsoever in parks. If you need to take a walk through your neighborhood, walk through a park. And I think that probably covers most of that, Kelly, right?
It does.
Yeah, great, thank you.
Thank you.
So there were a couple other questions that were emailed in that I don't think we covered. Besides the 2 shelters and the LBCC clinic, where else will the National Guard be deployed within the city? Do we have that information?
At this time, the National Guard is not being requested for any humanitarian support anywhere else in the city. So it's just the 2 shelters and the rapid assessment clinic.
And some additional information on the National Guard. So the National Guard request, just to be clear, was made by the city of Long Beach. So the city of Long Beach put in the request, as have other cities in California. It's 50 members of the Guard that will be yes, they will be in uniform. They will also be unarmed because they're doing humanitarian work and they're assisting our health department to ensure that our shelters and our clinic are safe and orderly. And so if you see folks of the National Guard, thank them for their contributions and for helping us as a community and our city. They're being deployed up and down the state.
And then the last 2 questions are related to the healthcare facilities. Does the city expect the number of coronavirus cases at long-term care facilities continue to grow? And also have there 2 or more of the deaths been associated with a specific facility?
This time, based on privacy concerns, we don't discuss the number of cases per each of the long-term care facilities. We have provided the overall amount. In terms of the hospital situation, we are monitoring hospitals and the ability, looking at the number of beds available and others. And in those situations, we are currently at a good state and not at a point where we're looking at any sort of overflow situation.
Great. That concludes our questions for today.
Thank you. And now we're going to have Teresa Ayala Castillo do a summary for us in Spanish. Thank you.
Buenas tardes. Tengo nueva información sobre lo que la ciudad está haciendo con nuestros esfuerzos contra el COVID-19. Y estoy agradecido que la supervisora del 4º distrito del Condado de Los Ángeles, Janice Hahn, y la directora del Departamento de Salud estén con nosotros hoy día. Hoy tenemos 316 residentes con COVID-19 y estoy muy triste de compartir que hemos perdido 9 residentes por COVID-19. Todos nuestros esfuerzos en esta pandemia son para mantener la salud y prevenir la pérdida de vida en nuestra ciudad. Estoy muy orgulloso de cómo nuestros residentes han seguido todas las órdenes de quedarse en sus casas. Yo sé que es un sacrificio, pero sin estos esfuerzos estoy seguro que muchos más residentes fueran afectados por este virus. Hoy anuncio que vamos a extender el mandato de salvo en casa o mantener seguro en su casa hasta el 15 de mayo. Vamos a limitar los números de personas que pueden entrar a negocios, farmacias y restaurantes y vamos a decir que los empleados y el público tienen que usar mascarillas antes de entrar a estos negocios. Estas mascarillas pueden ser hechas en casa, no tienen que ser mascarillas cirúrgicas que usan los doctores. Y también tienen que lavarse las manos cada 30 minutos. La orden de salvo en casa sí permite que los residentes salgan afuera, corran, monten bicicletas, caminar sus mascotas, pero no permite que se queden en parques. Este domingo es especialmente importante que los parques van a estar cerrados. Entendemos que todos quieren estar con familia y amistades este domingo de Pascuas, pero la situación en este momento es crítica y tenemos que actuar en esa manera. Lamentablemente, todavía hay ciertas personas que no han tomado estos medios y por eso tenemos que enforzar estos requisitos. Violar esta orden es un delito menor que puede ser castigado con una multa. Nuestros objetivos es lograr el cumplimiento voluntario de estas reglas. Por último, quiero darle las gracias a todos los empleados de nuestro Departamento de Salud Pública hoy en esta Semana Nacional de la Salud Pública. Sin los esfuerzos de cada uno de ustedes, no pudiéramos ganar esta batalla. Ahora las palabras de la Janice Hahn. Primero quiero reconocer y agradecer al alcalde Garcia y todos los que han trabajado con la ciudad de Long Beach por ser increíbles compañeros durante esta crisis. A diferencia de la mayoría de las ciudades del condado, Long Beach no utiliza el Departamento de Salud Público del condado, pero hemos podido trabajar para coordinar todos desde nuestra orden de salud pública hasta nuestros cierres de playas, haciendo que nuestros esfuerzos sean mucho más efectivos. Nuestros esfuerzos están funcionando y estamos aplanando la curva. Hasta ahora hemos podido evitar que el aumento de casos colapse nuestro sistema de atención médica, pero eso no significa que deberíamos de parar. Es por eso que tanto el Condado de Los Ángeles y la ciudad de Long Beach han extendido nuestras órdenes de salud pública, salvo en casa o seguro en su casa, hasta el 15 de mayo. Sabemos que esto es difícil, pero es necesario para combatir este virus y salvar vidas. Con este fin, el Condado de Los Ángeles está creando nuevos programas para ayudar a las personas que se quedan en casa. Esta semana lanzamos un nuevo programa que ofrece entrega gratuita de alimentos y otras necesidades para adultos mayores de 60 años y personas discapacitadas. No es necesario registrarse para este programa. Para este programa puede llamar al 1-888-863-7411 entre las horas de 8 de la mañana a 5 de la tarde de lunes a viernes. Sé que quedarse en casa es difícil para muchos de nosotros durante esta época del año. Este fin de semana, las personas que celebran las Pascuas tendrán que hacerlo sin misa en persona y reuniones familiares. Mantenga a su familia y seres queridos seguros y celebren en casa este fin de semana. Como precaución, todos los parques del Condado de Los Ángeles estarán cerrados este domingo, igual que los parques de la ciudad de Long Beach. Cuanto esto es muy difícil para todos, quiero agradecer a todos los empleados esenciales por su sacrificio y su tiempo. Muchísimas gracias.
Y muchas gracias también a Teresa y a todos que están acá, a la supervisora Janice Hahn y Kelly Colapi del Departamento de Salud. And again, just thank you all for joining this briefing. And please have a safe weekend, and we will see everyone again on Monday at 3 p.m. Thank you.